COVID-19 started, it definitely had an impact on all of the healthcare services normally available to people. This happened because of the lockdown, because of travel restrictions, but also because of the understaffed hospitals and overwhelmed healthcare system. Very early, the reports started to come in that women in different countries have problems in accessing abortion services. In the countries where traditionally abortion has been an issue, there were even some additional restrictions. And that made me really angry, but it also made me really curious about how are policymakers across Europe and the world going to react to this crisis, and what are they going to do?
In the wake of the COVID-19 crisis, the Polish parliament debated the stop abortion legislation with the purpose to even further restrict access to abortions by eliminating the fetal impairment as a legal grounds for the procedure. This government initiative triggered massive online protests in April 2020, and the government was accused of using the COVID crisis in order to pass this controversial bill. The Polish Constitutional Tribunal confirmed in the October of 2020 that fetal impairment is no longer considered as a legal grounds for the abortion procedure in Poland, and the ruling finally came into effect on January 27th of 2021. Given the fact that fetal impairment in 2017 represented at least 98% of all abortion procedures conducted in Poland, this means that abortion access in the country is now almost completely blocked. And the ruling of the tribunal actually triggered massive demonstrations in the country, which assembled over 100,000 people in the streets of Warsaw and other cities, and led to very violent protests and clashes between the protesters and the police. We found that a number of countries facilitated access to abortions during the COVID-19 pandemic. They used policy change, and in that sense, they used one or a combination of several following measures to ensure easier access to abortions for women. This refers to the introduction of telemedicine. Following that, of course, facilitation of early medical abortion at home with the help of telemedicine. Increasing of gestational limit for early medical abortions, removal of mandatory waiting periods or mandatory consultations with doctors, and other measures taken in that sense.
What did we learn from our study, and where do we go from here? Well, we provide policymakers with a framework on what they can do to improve abortion access right now during the pandemic times, but also some measures that might be also valuable to adopt even during